Occupational English test. Listening test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Can you tell me your name and age?
My name is David, and I am 45 years old.
Can you tell me your address and where you live?
My address is 1234 Sydney Road, Melbourne, Australia. I live in a house in an urban area.
Can you tell me about your closest relatives? What do they do for a living?
My mother is a housewife, my father is retired, my brother is an accountant, and my sister is a teacher.
What brings you to the hospital today?
I have been experiencing severe abdominal pain and vomiting.
Can you tell me about your past medical history?
I have a history of alcohol abuse and have been diagnosed with chronic pancreatitis. I have been hospitalized for this condition before.
Can you tell me about your family's medical history?
My father has a history of hypertension.
Can you tell me about your social history?
I am divorced and have no children. I live alone and am currently unemployed.
Are you currently taking any medications?
Yes, I am taking pancreatic enzymes, Creon, 1 capsule with meals and snacks, and pain medication Tramadol, 50 mg every 6 hours as needed.
Can you tell me about your dietary habits?
I am a heavy drinker and have poor dietary habits.
I see. We will need to run some tests and perform a CT scan of your abdomen and pelvis. Also, we need blood tests including liver function tests and amylase levels. We will also take your vital signs.
Okay.
Based on your symptoms and medical history, my assessment is that you have chronic pancreatitis. We will need to manage your pain and assist you with fluid and nutrition. We will also refer you to a specialist for further management of your condition, a dietitian to develop a plan for appropriate nutrition, and a social worker to assist with employment and housing issues. We will schedule follow-up appointments with your primary care physician to monitor your progress.
Okay, thank you.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Hi, Sarah. My name is Rachel. How are you feeling today?
I'm feeling a bit better, thank you.
Can you tell me a bit about yourself? What is your name, age, and address?
My name is Sarah, I am 35 years old and I live at 5 Smith Street in Sydney.
And what type of residence do you have? Is it a house or an apartment?
It's an apartment.
And what area of Sydney do you live in?
Inner city.
Can you tell me a bit about your closest relatives? What is the name and occupation of your husband, and how old is your daughter?
My husband's name is John and he's a software developer. My daughter's name is Emily and she is 8 years old.
What is the reason you are presenting to the hospital today?
I have chest pain and shortness of breath.
I see. Can you tell me a bit about your past medical history?
I have hypertension and asthma. I have also had a previous myocardial infarction.
What is your family history of illness?
My father has a history of heart disease and my mother has a history of diabetes.
Can you tell me a bit about your social history?
I am a stay-at-home mother and takes care of my daughter. I'm a non-smoker and occasionally drink alcohol.
Are you currently employed?
No, I'm not.
Are you allergic to any medications?
Yes, I am allergic to penicillin.
What are your dietary habits?
I am a vegetarian and avoid dairy products.
What medications were you taking before coming to the hospital?
I was taking lisinopril, 20 mg daily, albuterol, as needed, and aspirin, 81 mg daily.
I have your vital signs here and your blood pressure is 150/90 millimeters of mercury, your heart rate is 110 beats per minute, your respiratory rate is 20 breaths per minute and your temperature is 37.5 degrees Celsius. Based on your symptoms, past medical history, family history, and vital signs, the doctor has diagnosed you with an acute exacerbation of asthma and acute coronary syndrome. We will be ordering an ECG and chest X-ray to confirm the diagnosis and to see if there are any other issues. In terms of nursing management, we will be starting you on oxygen therapy and giving you IV medication to manage your asthma symptoms. We will also be starting you on aspirin, clopidogrel, and heparin for your acute coronary syndrome. As for your discharge plan, we plan to discharge you on January 25, 2023. We will be arranging follow-up appointments with your primary care physician and a cardiologist. You will continue your current medications and will be advised to adhere to a low-salt, low-fat diet and to avoid triggers for your asthma.
That is the end of Part A.